So one very important complication to avoid after big plastic surgery procedures are things called blood clots or pulmonary emboli. These are basically a little collection of blood that coagulates and forms a clot and then tries to make its way up to the lungs. We typically think these blood clots develop in the calves, sometimes in the thighs, sometimes even in the pelvis, and these little clots then migrate up the inferior vena cava into the right side of the heart and then typically lodge into the lungs, causing a pulmonary emboli. So to minimize these, we do a couple of things. One, we get you walking fairly early after the surgery, if possible. Two, we give you these leg squeezers which compress the calves during surgery. And three, what I typically use are these shots of Lovenox. Now, one of the important things with my types of patients and the surgeries that I do is we don't want you walking too much because there's too much tension on the incisions. So from these larger tummy tucks and these body lifts and these leg lifts, you're down in the chair or in bed for at least a couple of days, maybe a week or so, and that's a perfect setup for a blood clot. So to minimize this, because we don't want you walking, I use these Lovenox shots. So let's go and see actually a patient having a Lovenox shot after her body lift before her trip back to the East Coast. So I think the hardest part of these syringes is taking the top off. So this is Lovenox, all right, and they come preloaded with fluid. It's right in there. So what you want to do is you want to just pull it straight up. 1, 2, 3. See? And there's the needle. So the hard plastic comes off, soft plastic comes off, so you just pull it straight up. Don't twist it, don't bend it, just pull it straight up. Okay. And then it's fairly easy. Just take a little alcohol swab into the arm or the leg, and you'll just pinch and you'll just sink the needle, 1, 2, 3, and then just inject. Boom. So you just push all the way down, and this thing is spring-loaded, so once it goes all the way down, the needle pops back. So it's as simple as that, just to give yourself one shot a day to minimize the chances of a blood clot. It's typically what I use after a larger procedure like a body lift or a leg lift to really minimize or almost eliminate, in my practice, pulmonary emboli or blood clots. And if you have any questions, please give me a call.